Stakeholders in the health sector have called for collective action to improve COVID-19 vaccine intake in Nigeria to achieve the vaccine's global target. The stakeholders made the call at a meeting with Northern States heads of primary healthcare development agencies on improving COVID-19 vaccine uptake, organized by the Center for Information Technology and Development, CITAD, in Abuja. Dr. Yunsua Yao, Executive Director of CITAD, said that the center observed that there was a lot of misconception, misinformation, and disinformation about the COVID-19 vaccine.
The objective is to protect the vaccine through countering misinformation, disinformation, and rumors that are so prevalent in the social media, but also in other non-social media spaces such as the conventional media, radio, and print media, to let the public understand that the vaccine is safe, that it's efficacious, and therefore it can protect people from contracting the COVID virus. As we worked, we would like to always compare notes, collectively recognize the progress we are making, and identify challenges that are arising out in the field.
Mr. Dayo Olaide, Deputy Director, MacArthur Foundation, said that directors of the primary healthcare centers and civil groups were brought together for experience and knowledge sharing.
We have called this meeting to be able to create a forum for them to listen to the civil society groups who are working in the communities and listen to their feedback, what they are saying in terms of vaccination, whether it's in terms of the attitude of the residents, whether are they coming out to take the vaccines, what have been their experiences and their challenges. And with that, we are hoping that the executive secretaries, as well as the relevant state agencies, will be able to use that experience to implement reforms to improve access for the general public.
Mrs. Aisha Kilishi, Executive Director, Federation of Muslim Women's Associations in Nigeria, Form 1, Bauchi chapter, said that there was low uptake of COVID-19 vaccine in the north.
This is the time for us to really make more impact by sensitizing our community, because this is the period that you can easily get to reach out to many people because of the utilization of the tafsir. And we are going to look at how we as women, we can reach out to more women in the communities, in the local governments, to really sensitize them about the vaccine. We are also going to partner with the primary health care so that the vaccine will reach out to where the women or the general public needed it, not only at the facility.
In his remarks, Dr. Hassan Musa, COVID-19 vaccine uptake advocate and social influencer in Bauchi, commended CITAD for the initiative.
We expect that stakeholders will brainstorm and discuss issues around their experiences, challenges, and how to mitigate them. We expect at the end of this stakeholder engagement, we should be able to come up with solutions, policy recommendations, and policy recommendations that are aimed at addressing these identified challenges across the country, especially across the 6 selected states. The states are Bauchi, Kogi, Borno, Kano, and I think